I am Kate Quirke, CEO of Alcidion, Australian-listed healthcare digital health company operating across Australia, New Zealand and the UK. Our real focus is around using data from existing sources to deliver smarter healthcare applications, smarter use of data in healthcare.
Always a pleasure, Kate, and definitely plenty of content on the feed to hear about specific projects and topics that Alcidion's been working on. But what brings you to HIC this time around?
Yeah, it's good. It's been a while since been at a HIC conference. I mean, obviously MedInfo, and I think it was probably before COVID, before we...
Yeah.
So that is, a long time ago. Always love coming to HIC, supporting the digital health community in Australia. Very specifically, we are really looking at, and I've been talking about today, kind of like focusing more on getting more out of what we've already invested in digital health. So this idea that, the nirvana of, digital health delivering is kind of elusive, right? Where it's always just that little bit further. We've got to do a little bit more. And now with AI, coming to the fore, and everyone talking about the amazing stuff in robotics and the amazing things we can do with genomics and so forth, I think we're sort of losing sight of the fact that we've actually still got to get a lot of building blocks in place and perhaps use the technology that we've already invested in to deliver some of those really early wins in healthcare that are really fundamental. And I think you've had Nick on the podcast talking about the benefits that we got out of the Alfred from delivering flow. So you're really talking about benefits to do with, increased communication, reductions in length of stay, better accuracy of the data that's being used between systems of engagement and systems of record. And these are things that we can deliver today. But I think we're starting to get into this idea that, the future is out there only in respect of AI, and we're not really focused on the fact that we can do amazing stuff now.
Well, especially in this current climate of being able to do more with less, I guess, but also just, like you said, you're looking at your existing infrastructure and resourcing capable. What can we do that's perhaps faster, smarter, better, and really addresses those issues now? So I guess position you for that next phase of growth, because there's that big bit to do in the middle before we get to that bit, right?
And if you look at the really successful hospitals, so I was talking today about, there's a study done in Newsweek and Statista about the smartest healthcare systems, smartest hospitals, and there's 330 that make the list. And the first Australian hospital is at 111 on that list. So we've still got quite the way. And they're not all US, okay? The US system is driven by a different, construct in terms of why being more efficient is important to them, because they'll go out of business, right? We're not going to go out of business in healthcare here and the type of systems we've got. But we still don't make it. There's Singapore, there's a lot of hospitals in Sweden and those Nordic countries that are really up there. And generally they've focused on a number of things. They've got really strong strategic leadership and vision around what they're trying to achieve by implementing digital health. And they're not trying to be all things to all people. They're really focused. They're also chosen, as I said, some very specific use cases that they want to tackle and gone all in on those. I mean, when you think about the communication and task management that just goes on in this country and how much there's doctors sitting there using paper, WhatsApp, Teams, maybe if they're lucky, a very specific clinical, task management tool, the inefficiency, and the phone and the pager.
Sure.
The inefficiencies of that is just insane. And yet we're talking about robotic surgery and all this stuff, which is absolutely brilliant. But you know what? The big gains could be made just by tackling some of these very, very simple but achievable steps in terms of being smarter. Yeah,
and I think that I could only imagine that by getting some wins in those particular areas, it then creates some of that, I guess, muscle and capability for being able to do bigger implementations of perhaps greater scale, but it also then gets that buy-in and confidence that's super critical in any kind of implementation as well.
And that's one of the other success factors when you look at these hospitals that made it into the top 100. They had early clinician buy-in. They understood the need to actually facilitate clinicians in respect of what they were getting out of their technology. And we've all heard about clinician burnout. We've all heard about the issues that EMRs deliver in terms of documentation and so forth. Yet many of these systems have got EMRs, but they've been able to then take the next step from implementing their EMR to understand how do you get value out of it that the clinicians will buy into and say, yeah, that's fantastic. That's helping me. Now let's go on the next journey.
And so you mentioned, so you're up on stage. Is that what you were kind of sharing?
I was on panel with some others who were talking about. I started off with that. Didn't want to depress people too much in terms of the elusiveness of digital health, because I think there's amazing things that have been done. And so following on from me with some people talking about their projects and some real there's simple, like a guy's in the Christchurch developed a rostering system for registrars.
Yeah,
amazing the impact and the saving. We're not talking about millions of dollars of investment. We're talking about real delivery of outcomes.
And I guess that too would be something of value to a lot of attendees that would walk away from this here, because sometimes you can attend any event, wherever you go, where it can be perhaps inspiring or thought-provoking to be able to speak about what the future may bring, but then you've got to get back to the grind, right? So being able to take away some practical capabilities that mean that we can move some small dials, even if a degree or two could have an impact.
I mean, one of the biggest issues we've got now is, now, I guess it's always been the case, we've got more demand than we can deliver, but it seems to be getting worse, and we know we've got an increasingly complex ageing population, so it's going to keep in that trajectory. If you can save just a little bit of time, if you can move somebody through the healthcare system one day earlier, half a day earlier, and multiply that by every patient, every hospital, the gains, I mean, we don't save money, we reinvest it back in treating more patients, right? But the gains of that are just phenomenal. And that can be done now. There's so many ways in which we could look at that from an efficiency perspective. Not that I'm against AI. I think it's going to be fantastic. And, of course, the stuff we're doing, diagnostics and so forth, is amazing. And I support all of that. But to be really successful in that, if you haven't got the underlying building blocks humming, I just don't think that we're going to deliver the value out of that.
Yep, absolutely. Well, speaking of getting those fundamentals right and foundation and the building blocks, always something going on in Alcidion. And what's on your horizon, short or long, over the coming months, and we can look forward to seeing?
Look, there'll be much more, I think, continued emphasis on patient flow, access and command. This command centre concept is growing, right? And we just signed, another regional health centre in Victoria that's now going to put it in across 15 hospitals. So I think we'll continue to see that rollout. Obviously, we did just get preferred provider for a big EPR deployment in the UK, so we're pretty excited about that. And we just went live with our ED and our full emergency department module off wire. Now, here in Australia, there's going to be a lot of people already got ED in their EMR, but not everybody's got the full-blown EMR. But in the UK and a number of the other countries that we're in, they're looking at modular deployments of capabilities. And if you marry together emergency with flow and hospital in the home, all on a single platform, you can see where we're focused. We're focused on reducing the amount of time people spend in beds in hospital.